Hello, hello, hello. Welcome to Moms in the Huddle. We're in the huddle. No parent stands alone. I am one of your hosts, Erica Morgan, the mom of Division One player Samaj Morgan at the University of Michigan. He plays wide receiver. He's in his third season. I'm also the mother of Tyler. Tyler is my eldest son. I know I look 25, but he is actually 27, going to be 28 next year.
Wow.
So I'm excited to be the proud mom of my two boys. And we are in the huddle with my sister over here to the left, right of me, I believe.
Once 6, 7, I don't know. Anyway, I am Jillian Blackwell. I am the proud mom of 3 young men. My oldest son is Mackenzie Big Mac Blackwell. My middle son, Mac, was in school, figuring out this entrepreneur thing. Love him. That's my big fella. And then I have Jonathan. I always want to say his full name. Jonathan plays for University of Wisconsin Gold Badgers. They actually play this weekend on Thanksgiving. I don't know who thought of that. Thanksgiving and Mother's Day. Anyway,
On Thanksgiving?
on Thanksgiving. But anyway, and then I have a younger son, Robert Blackwell, who plays basketball at Brother Rice. So that's why we're here. We're here because we have been sports moms. What, since our kids was 4th grade, 2nd grade? I can't remember.
Yes.
Yeah.
Since they were young. I mean, I know our boys been playing basketball together. They play football for a short stint together. So they've been in sports. We've been sports families for a long time, which is why Moms in the Huddle was started, because
Absolutely.
a lot of times people don't have an outlet to talk about what's happening in this arena, right?
Yeah, and especially in a college landscape that changes not on daily, weekly, annually, and so we want to just make sure that moms have the content, the concept of what's happening in sports as it relates to mental health. I'm super excited about today's episode. We brought in sports analysts, we brought in agents, we brought in therapists. And so I'm super excited about the continued conversations and the professionals that we bring in to talk to parents.
Yeah, I am too, especially when you're dealing with a lot of things, dealing with injuries with players. Like just last week, we had Maurice Norris on. Maurice Norris was a great young man. He played with the Lions. So to hear him and his mom talk about his injury that he had, that was more so dealing with the concussion part. But I will say a lot of these kids have injuries that deals with their bodies. I mean, Jillian, when you think about it, your child's body eventually pays a price. Getting out there, especially for basketball, especially for football, and other sport where contact may happen.
Yeah.
You know what I'm saying?
Yeah. And I'm not nervous, but I think I'm a nervous and excited at the same time, because when we're talking about something like every sports parent worries about, but doesn't always say out loud, injuries. My youngest, this, Erica, my youngest son, from the 10th grade to he's a 12th grader now. Every year he's had an injury. And so you live through that. You can survive through that, but it not only takes a toll on the student, but takes a toll on the parent. You see, my husband was actually at my youngest son's game. He wasn't playing. He was on the bench, and he said, who would have thought our son would be sitting on the bench? And again, you still got to go to the game because he's still a part of the team. And so, so we don't say it out loud. We pray about, I know for me, I pray about every game. Injury free, win or lose, injury free for both teams.
Yeah, I think when Samaj was in high school, he had I want to say a wrist injury, which is for a receiver. That's your hand. Your hand is what you're making your money with, which is that. So he had that injury when he was in high school. Thank God he hasn't had a major injury while in college or playing college football, but injuries do happen, which brings us to our episode today. We are bringing into the huddle today Dr. Bruce Levy. Okay, he is a surgeon, but I want to read his. I would have read his his CV, his resume. But let me tell you, anytime someone's resume is 130 pages long, that tells you that they are really contributing into their community. They're really contributing to their profession. And it is very, very impressive. But what I will read is his bio. And I don't think I'm going to even do it any justice, Jillian. But Dr. Bruce A. Levy was born and raised in Montreal, Quebec, Canada, and received his medical degree from the University of Montreal. He then completed his orthopedic surgery residency at the Mayo Clinic in Rochester, Minnesota, and an orthopedic sports and an orthopedics I'm sorry, in Rochester, Minnesota, and an orthopedic sports medicine fellowship at the Minneapolis Sports Medicine Center in Minnesota.
Yeah.
Dr. Levy spent most of his surgical career at the Mayo Clinic in Rochester, Minnesota, where he held the rank of professor of orthopedic surgery and was the past program director for the Mayo Clinic Orthopedic Sports Medicine Fellowship. He recently joined the Orlando Health Jewett Orthopedic Institute, where he now serves as the academic chief of sports medicine and director of the Sports Medicine Surgical Fellowship. How impressive is that? I'm not a doctor, but when I say this doctor is someone that we definitely want to bring to the huddle and talk about.
Yeah.
But here's the thing, since completing his training in 1999, Dr. Levy's clinical and research interests have focused largely on complex knee and hip trauma, with a particular emphasis on knee dislocation, multi-ligament knee reconstruction, and hip arthroscopy. I hope I pronounced that right. Dr. Levy is the principal site investigator for several knee and hip multi-center trials funded by the NIH and the Department of Defense. He is a member of the Herodicus Society, a consultant for the NBA Players Association, and served as a team physician for the U.S. snowboard team. Dr. Levy lectures extensively nationally and internationally and has published, check this out, Jillian, over 350 peer-reviewed papers in the scientific literature. Let's welcome to the stage Dr. Bruce Levy. Welcome to the Dr. Levy.
Hi, thank you so much for having me. And first off, I just want to congratulate both of you for this podcast and Moms in the Huddle. What a fantastic idea. And I have so many moms that have been impacted by injuries. You don't realize when you're taking care of athletes the effect it has on their families and, moms in particular, right? It's their babies.
I love it. I love it. I mean, when I think about like translation for the moms, we don't have just any white coat in the room. We have the guy. So translation, when she was reading off his resume, he's helping train the people who'll be taking care of our babies for years to come. So that's what I love. That's why this conversation matters so much for moms with athletes at every level, from like they're just starting out, rec leagues, all the way to college and beyond. He's covered it. So I'm super excited about having an opportunity to talk to him. So not just anybody, the guy is on the call with us.
The guy.
Well, it's an honor. It's an honor to be here with you.
Yeah. And not to mention you're on vacation. You're like, hey, I'm here and I'm going to still be on Moms in a Huddle, and I'm going to talk to you guys about what I'm doing in my journey. So here's my first question to you, Dr. Levy. You had quite a journey. You came from Montreal to Mayo Clinic, leading sports medicine, and now in Orlando. How did you first fall in love with orthopedics and sports medicine specifically?
Well, a lot of orthopedic surgeons, I grew up playing various sports, had several injuries, and actually had my first knee surgery when I was 11. Oh. And I did some sports that, pretend themselves to injury, like I ski raced and I raced motocross and did martial arts, and all of those things lend themselves to injuries. And then I had a bit of a freak, I would say, training accident with motocross, and ended up spending 3.5 months in the hospital. That was a doozy. That was definitely a turning point for me. And I remember saying to my mom, I think I want to be on the other side of this. Maybe I ought to do what the guy's name was Marty Kerner, was the surgeon that took care of me. And I remember when I went into the ER, he had been my orthopedic surgeon for many years. And he said, this one's not a cast. This one's going to take a lot of surgeries. You're going to be here for a few months. And I'm hoping that you'll be able to walk without a limp. And I had multiple fractures. They were open fractures. And then, unfortunately, I had a pulmonary embolus in my lungs. So I spent 3 weeks in the ICU. So it was definitely a different experience than my typical cast that he had to put on. And so I said to my mom, I think I want to be on the other side. And she said, well, that's nice, sweetie, but you need something you've never had: good
Mm.
grades to go to medical school.
Wow. That's
And
a
like a lot of kids, I was really focused on athletics, and school was important, but at that time I didn't certainly devote the time that I should have to grades. So in Montreal, when you're finishing high school, you have to sort of do 2 years of a junior college before you enter university.
oh,
And it was during that pre-college or junior college that I got injured. So
Wow.
obviously I missed the year, but then when came back, I took all the science classes, hired a tutor. In fact, my tutor was the smartest kid in the school. There were about 3,000 kids in the school. He was number one. And
wow.
so he tutored me in chemistry, physics, math, and biology. And then I got into university, like real university, did my undergrad in biology, and and had a minor in exercise science. So I became like athletic trainer during that time, and I traveled with the hockey team and the football team, and I took care of a lot of the athletes. And then I was fortunate to get into medical school at the University of Montreal. Well, when I got into medical school, I think his mother cried as much as my own,
Oh,
because he played such a huge role, my tutor, in getting my grades up. And then from there, I was fortunate to get accepted to do my surgical residency at the Mayo Clinic, and the rest is kind of history. And then after a long tenure there, my wife, who's from Southern California, basically was sort of done with the winters, and so we found ourselves here in Orlando. And now I'm with an incredible group of people at the Orlando Health Jewett Orthopedic Institute. And this is a all orthopedic hospital, clinic, surgery center.
wow.
And it's the first of its kind in the state of Florida, from my understanding.
Yeah.
And so now I'm doing everything I did at Mayo. I'm doing here, and we're really enjoying our experience here in Florida.
Man,
Wow.
was not a bad place to be, right? To do something that you're passionate about in an area where the sun is always out. So when I
Yeah,
think over your career, yeah, you talked about the U.S. snowboard team physician to consulting with NBA Players Association, and I hear your passion, right? You went from a young person being injured to hiring a tutor to graduating. I mean, you had a long journey. And sometimes when we stay in a particular career, sometimes the passion may leave. Like, oh, okay, I've been doing this. I've been doing this for a while. Let me try something different. What keeps you passionate about working with athletes after all these years? And now, not only you were working with athletes, now you're training. I think I'm in learning development. And we think about training the trainer, like you're training the next generation uh,
Hmm.
of physicians. What keeps you passionate about getting up every day and doing this work?
well, it's a great question. I've been fortunate that I've had what we call an academic career, where I chose to be in a place like Mayo where you're training residents, fellows, and students every single day.
Yes.
And I'm equally fortunate at Orlando Health that I'm training residents and fellows and students again. And I think that if I didn't have that, then I don't know. I don't know if I would be just as enthusiastic or as passionate about it. But I love training the residents. I love training the students and the fellows. And so that part is so enjoyable for me. I mean, you have a resident that hasn't maybe done any sports medicine surgery, and they start first day, and let's say it's some routine ACL reconstruction,
Mm.
and they're not necessarily sure what to do, right? Well, by the end of 6, 8, or 12 weeks, depending how long they're with me on service, they could fly through the case, like. So when you watch that happen over time, it's the most fulfilling experience you can imagine. And
Yeah.
then when you take more complex surgery, sometimes you have to go to our surgical skills lab and actually practice the surgery without a real person. And when you get really complex things and you watch them grow and develop, and then you go back into surgery and they're able to help and assist with these super complicated cases, again, it's just a feeling of, of complete fulfillment. So that's the part for me that keeps me going, is watching the residents and fellows, learn and grow and flourish. I mean, that to me is the most exciting part of what I do.
Hey, Eric, I know you have a question, but so when I heard you say simple ACL, when parents hear ACL, they're simple about ACL. My young son is going through PT right now from an ACL tear. So when you say, and I love that you're smiling when you say, we don't smile when we hear ACL tours, but that's not a tear. So
okay, so let's clarify. So from a surgical standpoint, in terms of technique, let's say, okay, doing an ACL reconstruction, once you've learned how to do it and where to put all your tunnels and things like that, it's a very straightforward operation. In particular, because I focus my career on people that dislocate the knee and tear all the ligaments in their knee. And so, you go from an hour operation to sometimes a 6 or 7 hour operation. And that said, even though it might be technically straightforward, there is no loss on us how difficult it is for the patient and their families. And I always tell the families, ACL reconstruction is a family sport.
yes,
because it is a long, difficult rehabilitation, and patients need a very strong support system from their trainers, the therapists, from their parents, their friends. It is a journey. It is a journey. And it's a journey with all of the surgeries that we do. And so I always say, yeah, your son plays football, but ACL surgery is a family sport.
Yeah.
you got a living witness over here.
Yeah, yeah.
Wow.
I've always wanted to know, now that I got Dr. Levy on, and I've always wanted to ask the doctor, we would see on TV where they have a lot of, when you're learning how to operate and do different things, did you operate on a frog first or an animal?
No. We actually operate on cadavers.
Oh.
And so people that are generous enough to donate their bodies to science. And I'll tell you that at Mayo, actually, they have every single year, they have a night that is dedicated to all of the patients that donated their bodies to science that were then used to train medical students. And the medical students, they invite all of the family members from these people that have passed away, and all of the medical students have to pay tribute to the cadavers that they have spent their year working on, okay? So imagine these medical students spend an entire year learning the anatomy and learning all these things, and it's a cadaver, right? But at the end of the day, the cadaver is a real person. And so they are in charge, whatever group of students, let's say 3, 4, or 5 students that had, let's say, cadaver X, they would find out about that person's life and they would present to the entire, people there, the entire group, the story of that person. They would get family photos from the families and talk about their lives, and they would do, violin or do plays or do dance or do something to pay tribute to all of these people that have donated their bodies to science. It's the most beautiful thing I've ever seen. And one year, I was invited to speak at this night on behalf of the orthopedic surgery department because, we practice a lot of surgery on cadavers. We actually have a surgical skills lab. We had one at Mayo, we have one at Orlando Health Jewett Orthopedic Institute as well. And this is really where most of the training occurs. So that by the time residents and fellows are actually assisting in surgery, they already know what they're doing.
Man.
Wow. Man.
That's awesome.
Well, I will say that that is very impressive. How many cadavers have you operated on or gotten practice on?
Oh, thousands and thousands and thousands.
Wow.
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 Yeah, I mean, we're going back, to med school. So that's 1988. You know,
Yeah. Well,
yeah,
well, it's great to hear that they have this practice, but I guess we don't think about what they have to practice on. As a parent, we wouldn't even think about that. But thank God, I go back to elementary when I was teaching my kids what practice makes perfect. And so we love to hear that they're not just operating on a frog, they are actually operating on a real leg, operating on a real,
right.
yes.
Right,
Mm.
exactly. And then when they do get to, operate or assist in surgery, they're supervised. I have made it a, sort of rule, if you would, that, I'm never out of the operating room. And so, people will give them more and more responsibility. Obviously, an intern is not going to do as much of the surgery as a chief resident,
Right.
who's done, hundreds of cases. And so there's a progressive learning and a progressive sharing of responsibility. But as the supervising surgeon, I am never out of the room.
That's awesome. Yeah. I got a question for you. So I want to switch over. Like, I want to talk about knees and hips and just plain language.
Sure.
So
Mhm.
what are some of the early, what are some, let me put it this way, preface it this way. So I remember a time I was watching Erica's son, Shamaj, play. He got hit. And I was like, now again, I'm a sports mom, but I'm a basketball mom. And so football is tough. And but when I saw Erica, not just her son, this other son get hit, I'm like, oh my God. So what are some of the early warning signs, like maybe subtle things in how our kids like move or they complain, what mom should like pay attention to before it becomes like a big injury? Because again, I asked that question because our kids have been playing for a young age, and we may be like, boy, go soak in the bathtub, or how do we? What are some of the signs that moms and dads should pay attention to before it becomes a real injury?
Yeah, so just in general, obviously, we don't like to tell people to play if they have swelling in their joints. So, for example, if
Mhm.
somebody has a little knee injury and then they have some swelling in the joint,
Mhm.
then the muscles around the joint won't function very well and won't protect that joint.
Yeah.
And so people that have swelling in their joints and their lower limbs in particular, like their knees, that's sort of a big no-no for us, letting them back in play. And so typically the trainers or the therapists or the doctors that are responsible for the teams, if there's been an injury, that's what they'll check for to see if there's any swelling in the joints. Now, if it's
Wow.
upper extremity, like your shoulders, your arms, it's a little different. But we know that a lot of swelling in a joint in the knee, for example, will automatically shut down a little bit of their quadriceps function, which is really important for them to play.
Mm.
Now, interestingly, for ACL surgery or for ACL injuries, there are ACL prevention exercises.
Mm.
And in fact, there's something we call the FIFA 11, which is a series of core stabilizing exercises that most of the world of soccer is, told to do. And it takes about 22 minutes to do it, even if you're fast. So unfortunately, a lot of clubs will do them for a while, then not do them as often. And these ACL prevention techniques are proven to help reduce ACL injuries. And now there's actually some AI-driven apps that are coming out on the market where you could stand, a certain feet away, and you plug the app in. It tracks you, okay, and then it has you land or do a jump, okay, like a vertical jump, and see how your landing mechanics are. And if they're off, the app will tell you you've got to do the FIFA 11. We call it neuromuscular training because we've learned that we can sort of reprogram how we land. Now,
Mm.
you may not know that females are way, way more at risk than males. And they tear their ACLs sometimes 4 to 5 times as often. In
Wow.
fact, the female soccer players, high school teenage female soccer players, are at the highest risk, and they're at the highest risk of ACL reconstruction failure too. And a lot of it has to do with how they land and their landing mechanics. And so anytime we have a female athlete that's torn their ACL, we give them the neuromuscular retraining, and we really try to focus on retraining how they land. Because funny enough, they land a little differently than their male counterparts.
That's crazy.
I know, isn't that amazing?
It is
Yeah.
It's
amazing.
amazing. I would have never
Yeah.
thought that a female would have more injuries more than, males. But I will say, when you talk about reconstruction, what material, when you're doing a surgery, is used in reconstructive surgery? Because if someone has shattered their knee or shattered their ACL, like we're talking about, what are you using to reconstruct these ligaments or these bones or these things? Because I don't know anything about it, but it sounds really difficult to reconstruct something like that.
Yeah, so that's a great question too. So when we use the word repair, that's sort of like if somebody tears a tendon or a ligament and then we repair the two ends, okay, with
Okay.
sutures or something. When something is not repairable, like most ACL injuries, the ACL just, it kind of explodes. You hear a pop and it sort of explodes. So you
Mm.
can't like put a stitch in it to fix it. So we have to replace it with something. That's where the term reconstruction comes in. And as a general rule, the two main options are something we call autograft, auto coming from you. So we take a different body part, like the middle third of the tendon between your kneecap and your lower leg bone. So it's called the patellar tendon graft. That's the most common graft that we use for ACL reconstruction in high level athletes. It turns out that the length of that is almost always the same length as your native ACL.
Mm.
And so that's a very common graft source. The other autograft, or coming from you, is taking a piece of the end of your quadriceps tendon, just above where it attaches to the kneecap. And that's another very popular graft. You can even take some hamstring tendons, which people think they're in the back of the thigh, which they are, but they attach in the front of the lower leg bone, your tibia bone. And
Yeah.
through a little incision, you can harvest with these tendon strippers, you can harvest the hamstring tendons and drill all your tunnels through these little incisions. Hamstrings, however, in my opinion, don't work quite as well as the other two grafts. And in really high level athletes, high school, college, pro, we take most often, at least the surgeons in my generation, the patellar tendon graft. It's also known as a BTB, or a bone tendon bone, because we take a little piece of the kneecap, that's the bone, the center third of the tendon, and then a little piece of the tibia, that's the other bone. So BTB or patellar tendon, those are the most common graft sources. Now, older people that are lower demand, you can actually do a cadaver graft, and that's called an allograft, where you can actually take a patellar tendon or a quad tendon or whatever you want. You can order it, and you can even order it to size.
Mm.
And so, and again, these are from people, thankfully, that have donated their bodies to science.
Wow.
Wow.
Man, I feel like I just went to medical school. No, I'm just joking. so,
And
I got,
I'm
go
sorry,
ahead.
but you make it so easy to understand. I mean, we don't know everything of what you said, but the way that you say we get it
Yes,
from graphs, different locations, different people, the
Right,
cadavers, and even
right,
ourself, yourself, you can get it. That's amazing. I used to think
right.
reconstructive surgery is just you're getting something foreign, maybe putting it in the body, is reconstructed to put there. Maybe that happens, maybe it doesn't. I don't know. But go ahead, Jill. I'm sorry.
no, no, no. I mean, I'm trying to put on the hats of myself when my kids were younger and things that we can do to prevent injuries. I'm thinking about my husband when our kids were in multiple sports. So there's been a lot of conversation around like overuse injuries and kids,
Oh,
especially
yeah.
in one sport year round. From your perspective, how big of an issue is that, and what should parents be thinking about?
Well, I got to tell you, I think that the research is actually quite clear that people that are involved in multi-sport seem to do better at the end of the day than people that are
Wow.
100% focused in one sport all the way through. Because When you're doing multi-sports or different sports, you're using different body parts.
Yeah.
And so you don't have the same overuse injuries. And not only that, but from a coordination standpoint, it seems to be very helpful when you're involved in different sports, again, because you're using different muscles. And the more muscles you use, the more stabilizing those muscles are to your joints.
Yeah.
And so I'm a huge fan of, listen, you can't be a good runner if you don't run, okay? So I get the concept of you can't do well in football if you're not playing football.
Right.
But I think that the data is very clear that if you're involved in other activities as well, it does help your overall coordination.
Okay, so wait, I just want to hone in on that. So again, is there a particular age? For example, and I'll just use Erica's son, Shamaj, and my son. So they played from fourth grade together. I think both of them played football and basketball. And then when they got to high school, and that's what and I'm married to an athletic director. They get to high school and they all decide, I'm just going to focus on basketball. And everybody can't be a Deion Sanders, right? Because he was doing right. And so,
Yeah.
is there a particular age where the body has been developed enough to say they can focus just on one sport, or if you could tell us that.
Yeah, I don't know the answer to that.
Okay.
I
Okay.
do know that the problem seems to be when they start super young and they're just in one sport all season long.
Okay.
Yeah.
Okay? Full year round, just doing soccer, nothing else. Full
Wow.
year round, just doing basketball, nothing else.
Yeah.
That doesn't seem to be as that. First of all, it also causes them to burn out.
Yeah.
Okay. So, there's that factor as well. There's a huge psychological factor, an emotional factor that goes into all these. But the younger athletes that are involved in multiple sports, like your children were, is actually really beneficial for their overall growth and their development. Now, as they get to high school or college, of course, you can't do it all.
Right.
So, but then if you're going to do it, take some breaks and
Yeah.
don't be 24/7, 12 months a year on one sport, because I think that's where overuse really occurs. And you haven't had a chance to develop the other muscles that might be necessary to stabilize your joints, and you get burned out.
Yeah.
Yeah. And I will say, I can attest to that. When Samaj was much younger, he wrestled, he played football,
There you go.
he also played basketball. And I would say he did not have a lot of injuries. He was working on different parts of his body. And
Right.
he did like 5 things even before
Right.
college. So even now, he doesn't have a lot of injuries. He's not injury prone. He may have had like the concussion, because that's with football. But
Yeah.
down to any other bodily injury, he really has not had that. So I
Right.
see what you're saying, Dr. Levy. When you play multiple sports, it works
Yeah.
out different parts of the body that it helps
Yeah.
you staying
I
grounded.
I firmly believe that. And if you look at any professional athlete, a lot of them did multiple sports when they were younger.
Yeah.
Yeah.
Athletes are athletes,
Yeah.
athletes are athletes. My oldest actually played, semi-pro soccer, and he actually played football, basketball, baseball,
Mm,
soccer, taekwondo, right? And
yeah.
all of those things helped him all the
Yeah.
way up to, a short period playing as a goalkeeper with the Minnesota United.
Oh, wow.
And so, I witnessed it. And he also actually saved himself from a lot of injury because he was a multi sport athlete, and he never got burnt out. And he was constantly developing all these stabilizing, muscles and things because he was using different body parts.
And actually, I remember one of my son's doctor told him one time, this year, I at least want you to take 2 weeks off. Just take 2 weeks off of the sport. He said, I know that you're busy. He said, but if you can take 2 weeks off, the way that the body can recover in that time,
Right.
and the
Right.
way that you're able to get back into it, you can't be every day, all day sports. So
Right.
we had to have him take some time off. So
Right. Well,
good
look at
information.
pro athletes. Is there any pro athlete that is 365 days a year?
No, they're not.
No.
No.
Right. That's right. And yet we do that to our 8-year-olds.
I know. That's crazy. Yeah, I wanted to bring some familiar pictures. This is, well, let me just start with this one. This is our youngest.
Oh,
Um,
Oh,
yeah, this was right after surgery. The medicine, medicine after he was calmed down, he was like, "Oh my God, that's a whole nother story." And this is him during PT. You see the brace here. We've
yeah,
had my oldest son pulled his fibula and his tibula. So you're talking to a mom who, this is an ACL. This young man has had 3 different
yeah,
surgeries. So what do you say to parents? And I think you started off by saying that is that an injury is a family sport, but how
yes.
do you encourage parents whose children have love for the sport, right? But is going through an injury. What encouraging words would you say to parents that we can give to our children? I call this guy, I keep telling him, you're going to be the comeback kid, right?
Yeah.
But you got to do
Well,
and pay attention to what the doctors are telling you to do.
yeah. I think what I found that parents and the athletes appreciate is I show them case presentations of other athletes with their same injuries. And I have like all these different, PowerPoint presentations with these lectures that we do. And it shows them, okay, look, here's this young man, same age as you, same injury. Here was his road to recovery. Here's what the leg looked like here. Here's what the leg looked 6 months later. Here he is back playing football or baseball or soccer. And so you explain to them this is a long process, but you will get back, barring any unforeseen complications. And, you show them. So I found that when I can show case examples of injuries similar to theirs, similar age range, and that the patients came back, then they lock into that, right? And then they have that all through their recovery that, hey, so-and-so made it back. No reason why I can't make it back. Now, I'll tell you a really interesting story. When I was still at Mayo, there was actually a UCF athlete here in Orlando that had a terrible knee injury, without mentioning any names. And after he had some initial surgery, first in Tampa and then in Orlando, they sent him down to Mayo, and we reconstructed, most of his knee. Okay, and he went through a long journey, obviously, with his parents and his family and supporters. Well, about a year ago, a young patient came into my clinic with the same injury, literally the identical injury.
wow.
And yeah, and you'll love this. And so I was able to show him this other person's, had the same MRI, the same injuries, the same journey, and they got back and they were able to play football again. And there's no reason that you won't be able to get back too. Well, the best is I had the two. They asked me because this Orlando athlete is fairly well known and was an inspiration to this young man. In fact, he found out about this young boy's injury and sent him a video
Oh,
telling him, "I've been through it. You're going to get through it." I mean, it was incredible. How the athlete even found out about this young kid, who was 15 years old at the time, I don't know.
awesome.
But he sent him this inspirational video. Well, wouldn't you know it, the young boy who's now a year from his surgery and he's doing very nicely during his rehab, he said, "Is there any way you could ever introduce me?"
Right.
And so I said, "Sure." So this past Friday, we met with the young boy and his parents, and we introduced him to the athlete who's now not, he's past his career, right?
Great.
And turned out that his parents, the ex-athlete, his parents happened to be in town too at the same time. And so this literally took me by surprise. So the two of them meet and we're talking, blah, 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 and everything's going well. All of a sudden, the ex-athlete's mom shows up.
Okay.
And she knew about this interaction, right? And she
Right.
comes up and she meets the boy and she sees the family, and then she starts to cry. And she says, "Oh my gosh." And she looks at the mom and she says, "It's like I'm having PTSD thinking about where I was when you were." And the two moms hugged and just started to cry. Of course we were all crying. But
That's
like you realize the impact it has on the family when it's your child and you
Yeah.
just see
Yes.
I mean, it was incredible. It was such a beautiful moment. And
Right.
she said, listen, as hard as this is, look at my son now. He's doing fine, and your son is going to do fine too. But
Yeah.
you really see, I mean, talk about moms in the huddle.
Literally like that.
Oh, that's
Yeah,
beautiful.
talk about moms and hope. I mean, I will say that's a beautiful story, Dr. Levy. I will ask
Yeah.
you this. You seem like you've operated on a lot of people, right? A lot of injuries, correct?
Oh, yeah.
Have you ever got prepped? You're getting ready to operate, or there are things that are happening to where you know this patient has an injury. You've seen it on the x rays, everything's there. But then when you go to take another x ray before surgery or while in surgery, you see that the body somehow healed itself and maybe they don't need surgery, or maybe it wasn't what you thought it was when you got in there.
Oh, that's such a fantastic question. And yes, that happens actually, Erica, all the time. All the
Really?
time. Yes. Yes. So
Wow.
the body is amazing. Okay. And there are many, many different injuries that have the capacity to heal. As
Wow.
a general rule, the ACL is not one of them. Okay, although there's a tiny little subset of sort of middle-aged people that tear their ACL skiing. Interesting, where the the tips of the skis cross, and
Mhm.
then all of a sudden, they pop, and the ACL pops, and the ACL, instead of like exploding in the middle, it just peels off of its attachment site. Okay, it peels off the wall, and oftentimes those will stick back to the wall and can actually heal. And there's a surgeon from New York, actually, from the Hospital for Special Surgery, Dr. Robert Marks, who wrote a paper on these skier injuries. And so those, I wait and watch and see what happens, because if they stabilize, then we don't have to do anything. And what happened with him is he would book them for surgery, they would
Mhm.
do their rehab, then he would get into the operating room and he would examine the knee, and the knee was stable. And he'd be like, what in the world? And then he'd put the scope inside the knee, and the ACL looks normal. And so he would just pull the scope out. And so this happened enough times that he started following these particular skiing injuries, and turns out that a certain subset of them can heal without surgery.
I
Now,
love
we've learned when people dislocate the whole knee joint, like these athletes we were just talking about, that depending on where the ligament tears, sometimes it has the ability to heal. And so oftentimes I'll list people for, let's say they've injured 4 ligaments, and I'll list them for 2 that I know for sure haven't healed because I've examined them before surgery. And then
Right.
the others are possible. The others are possible. And
that.
it'll depend on the x-rays that we take in surgery, or most likely our examination under
Mhm.
anesthesia, and how we examine the knees and how they feel.
Gotcha.
Wow. What is that called though, Dr. Levy, when it comes to where, how is it that the body is able to have what we call maybe muscle memory to say, hey, you're supposed to be connected or
Right.
recreate or come back? What do you think that's about? Because I've always been interested
Uh,
when doctors come
yeah,
home, they'll see an injury and then they come in there miraculously, it's something happens. You guys don't even have to
right.
do.
Yeah, it has to do with blood supply. So if there's good blood supply to the area, then there's a lot of growth factors and healing things that can come in and help heal those structures. And if there's areas that have very poor blood supply, then the ability of the body to heal those things is very, very low.
Yeah.
And so a lot of it has to do, that's why I'm saying where the ligament tears matters, because if it's close to an area where there's good blood supply, then there's all the healing potential.
I
Wow.
love it. It's all in the blood. All in the blood.
All in
All
the
blood.
blood. You know what? It sounds like the way that God created the
Yes,
body.
it is.
Did it
Absolutely.
in a way that it can heal itself, but he has Dr. Levy and other surgeons to say,
Yes.
hey, I'm assisting you as best I can, but you guys got to come in and be my
Yeah.
hands in
I
that
love
room.
I
Thank
love
you.
Well, let me tell you, we should talk about that a little bit,
Come on, go ahead,
because,
Dr. Levy.
yeah, because I am a firm believer that there are definitely outside forces or inside forces that play a big role, okay? Because I have seen people come back from injury that no one's ever come back from injuries like that, okay? And so let me tell you, God has a role
Yes.
in all of this, okay? And I don't know how those decisions are made, but I can tell you that I have seen some athletes come back to sports I never thought in a million years possible. And when I witnessed it, it's like I'm watching the seas part, okay? It's
Wow.
like it was like watching a miracle happen unfold in front of my eyes. I've seen it several times now, where I like, there's no way this person's ever going to get back, and then they get back, and you're like, how is that possible?
Wow. Oh, I love
So
hearing stories like that.
yeah,
That's
yeah. So let me tell you, God's healing plays a huge part in
yes,
all of this.
yes,
Yeah,
it does.
thank you,
Yeah,
Lord.
and that's what we're telling our son. You're going to be the comeback kid. Stay faithful. Do what you have to do in the natural, but
Right.
also talk to the Father. Question for you. So we talk to parents. I want to talk a little bit, and I know we're close to time. I want to talk a little bit about coaches who are anxious and perhaps their star player, he'll be okay. Put him in the game. What do you say to coaches about injuries? Because oftentimes, or it's even not maybe not even being a coach. It could be
Could be the player.
but could be the player. It could be some ancient, some over aggressive parent. You'll be okay. How do we safeguard? And you talked about there might be teams that might have a doctor on the side or a nurse on the side, or a physician or someone medically trained, but oftentimes they're not there. So what do we say to parents, athletic directors, coaches about making sure your child is safe and
Yeah.
not only worrying about the X's and the O's?
Mm.
Yeah, listen, it's very hard, right? Because they're under so much pressure, right?
Yeah.
The pressure to win and the pressure to, get funding or whatever. The pressures are massive, right? They're massive.
Oh,
But at
yes.
the end of the day, the interest, the only interest that should be considered is the best interest of the athlete. Period.
Absolutely.
I mean, there's just there's no gray area there. And so most contact sports now, football in particular, there are, athletic trainers that are at the game. I mean, if I recall from high school sport, you almost have to have some medical professional that's around. If not, there are, EMTs that you can call. I mean, there's all kinds of ways to get people to be quickly evaluated. And when in doubt, sit them out. I mean, it's just that simple, right? I mean, especially concussion. Right now, we're so familiar with concussion that if there's ever a question of concussion, you grab the helmet and they're done.
Yeah.
But you can play through some injuries, right? It all depends. I mean, if you are a big time soccer player and you injure your finger, you're probably okay.
Yeah.
But if you have a bad knee injury and your knee swells up, you shouldn't be going back out there.
Right.
So you would like to think that everybody has the athlete's best interest at heart, and that's really, I think you make that presumption that really nothing is worth putting the athlete's risk or the athletes at risk, right? You just pray that would never be the case.
Yeah.
And if you have a team that for some reason doesn't have an athletic trainer, maybe that's a fundraising opportunity to get an athletic trainer, because they are incredible, having been one, right? And I think that they're extremely knowledgeable and they are really amazing for sideline assessment. So I would encourage everyone that doesn't have an athletic trainer to try to find a way to if possible, to get funding to have one if they're not there.
Wow. That's awesome. Well, I will say, I want to ask you one other question before we get
I know
there.
I know you're going to ask that question that you asked, but I got.
I'm going to ask.
Oh, I'm sorry. Your last question was
No. It wasn't even that one, Jill. It's on our list that we have here. I want to kind of shift it to I know, because Jill know that is one question we ask before we get you out of here. We're not there because Dr. Levy, you pulled on us, so we're pulling on you so much. We're 49 minutes. We're really enjoying this conversation. So you can bear with us another 5-10 minutes.
It's my pleasure.
The next question I wanted to ask was, you've worked with pros and elite athletes. What are some things pro organizations do really well around injury prevention and recovery that you wish could trickle down more to some of the youth sports?
Yeah. Well, listen, they have teams, right? They have trainers, they have therapists, they have medical personnel. And so there's so many people that can assess the athlete and then follow their recovery and their rehab. What we do is, let's say we do an ACL reconstruction, we communicate with the trainers, with the therapists, with the team doctors, and so we make sure everybody's on the same page with regards to their rehabilitation process. And I think that communication is so paramount in a successful recovery. But at the high school level, you don't always have all that. Now, high school, we cover a huge amount of high school football teams. There's always a medical provider in Orlando, whether it's a physician assistant, an athletic trainer, a physical therapist, one of our residents, or us. We make sure that there is some medical or paramedical personnel at every one of those games. And that's what I'm trying. That's really, really important.
Wow, that is something. Okay, Jill, you can ask some more questions. We have another 5 minutes at least.
I know you were getting close to your ending question. I wanted to make sure I asked this. So my background, I've worked for Microsoft. I now work for Amazon. I'm in the tech space. And so everything we talk about now is AI, artificial intelligence. Where are you seeing that play? I was talking to actually my dentist, and they were talking about how they're using AI.
Yeah.
Where AI play in everything that you're doing when you're teaching? What are some of the conversations that you're having about AI and how AI is going to play out in the industry?
Well, it's interesting. We actually, when I was still at Mayo, we put together 25 years of data on ACL injuries in our local community there in Olmsted County. And we put, over 50 variables, okay? Age, sex, BMI, right, left, time of injury, time of surgery, all the meniscus tears, cartilage damage, the type of grafts, the rehabilitation when they went back to sport, all these things. And we then used our supercomputers to develop AI modeling to then predict who's going to fail, or and so we have a lot of this information already, and we can, with AI, as it gets smarter and smarter and smarter, it's predicting, for example, when we do hip operations, when people are ultimately going to need their hip replacements, or who's at risk to develop their hip, have a hip replacement after they have a hip arthroscopy, it's called, where we put a camera in the hip and we fix some things inside. And so, but the other one I was mentioning earlier was these apps that are using AI with all that they had. In fact, in Canada, they have this one company where they track 2,500 university athletes. And based on how they land, on their landing mechanics, they were able to predict who was going to tear their ACL.
Oh my.
And so, can you believe that? And now, as the AI is getting even smarter, we're able to use that same sort of platform to test athletes after surgery to see how they're landing and how they're jumping, and if they need more neuromuscular training or if they're ready to return to sport. So, AI is incredible because it learns as it goes, but you still have to plug in. You can't imagine the team of summer research students that were gathering all the data to plug into the supercomputer modeling that we had, for all of the ACL information. And as it grows and grows and grows, it'll get smarter and smarter and smarter. And so theoretically, you'll be able to, use these apps, test how you're landing, and then if you're landing good, okay, you do neuromuscular training once a week. If you're landing badly, don't go into sport and do neuromuscular training for 2 weeks, then redo the test. And if you're landing better, well, maybe you got to do neuromuscular training every other day. Well, if you're still landing badly, well, guess what? If you want to play soccer, you got to do neuromuscular training every single day. It's like brushing your teeth. So I think that there's tremendous applications in the world of sports medicine surgery for AI. No question about it.
Can I just add a part B to that? So think about, Erica,
Yeah.
when I'm thinking about this AI, and when you think about NIL, right? So they take
Mhm.
data to say, okay, your market value is X based on
Yes.
you're injury prone, little, it's just interesting. You know what I'm saying? Okay,
Right.
that's very interesting. Okay, that's
Yeah.
Yeah, could
That's
happen. Could
yeah,
happen.
Yeah, because they could come to you, Dr. Levy, to say, okay, we want you to measure this athlete to see
yeah,
are they prone to an injury. And if
yeah,
so,
Yeah.
do we want to invest our money into them? Because
absolutely.
sometimes NFL, maybe NBA, look at some boys
Sure.
have had injuries as damaged goods. So how much do we really want to invest in this player? And are they really going to be here with us for the long haul?
Yeah,
Right?
Yeah.
Yeah.
Listen, when you're dealing with contact sport, it's very different, right? When you're dealing with less contact sport, that's where, the AI modeling might have higher predictive value.
Mm,
But contact is contact. There,
yeah.
there was an athlete that had an ACL injury, actually ACL and his MCL, which is another ligament in the knee, and he had surgery. It was a beautifully done surgery, and then he got hit, contact helmet to the knee, and blew everything apart. Right.
Oh,
So comes and sees me, and we redo it. And it's very stable, and it's good, and everything's good. And then he has literally the same contact injury and blows it again. I mean, you can't. Contact is different. So
yeah.
you can't necessarily predict what's going to happen when you have, you know, that type of kinetic energy hitting each other.
Yeah, it is. It's some football is definitely something different. Sometimes I
Yeah,
like, what's wrong with baseball? But then we got the balls, and then we got the arm. We think about so many things, but
yeah,
our kids would not have it any other way. They love
yeah.
to do what they're
yeah,
doing, just like you, Dr. Levy. You love doing what you do for the people and just being a surgeon and helping people out. So we appreciate that.
yes.
But I will say before you leave,
Yes.
I want to ask you this one question. Your journey in one word.
My journey, like becoming a surgeon,
Your journey, your life journey, a surgeon journey, Dr. Levy journey in one word.
awesome.
Oh,
I like that.
love that. Yes.
Yes, I like that, Dr. Levy. Why would you say awesome, Dr. Levy?
Well, I mean, it's an unbelievable thing to be able to put people back together.
Hmm.
I remember when I had that bad motocross injury, and I was in a million pieces. I felt like I was in a million pieces, right? I had multiple fractures, and there comes Dr. Marty Kern. He's like, "I got this. I
Yeah.
got you. You'll be here for a couple months, but I got you." And I remember thinking, like, how in the world can anyone like just be like, "No big deal. I'll take care of it," right? Like I'm in a million pieces. How could somebody do that?
Wow.
Right? And so I remember thinking, if I could have one person feel about me the way I
Yeah.
felt about that guy,
Hmm.
my life would be fulfilled, right?
Yes.
And that's like, 20,000 surgeries ago.
Yeah. And how many
Right?
students ago? How many fellows ago? How many? Yes.
Right. Yeah. Yeah. So
Great.
yeah, listen, it was 17 years after high school of training, and it was all worth it. It was all
Wow.
worth it. Yeah.
17 years. But we
17 years after high school. Yeah.
but we
Yeah.
thank
That's the road.
Thank you for your service, Dr. Lee, because that takes a lot. People don't, you're serving the community. You're
Yes.
serving,
Yeah.
you
Well,
know,
it's a privilege. It's a privilege to do it, I could tell you. And that's not lost on any surgeon. You're not going to find a surgeon who's going to feel differently about that. It's an incredible privilege to be able to do this.
That's awesome. I mean, we need a t-shirt that says you put people back together again, like the bionic man. I love it.
Yes. Well, Dr. Levy, thank you for your time here today. We're going to have you back. I'm excited about when you do come back. We'll announce that a little bit later, but you have something else and more things to share with us. And welcome to the huddle. Thank you for being in the huddle, and we can't wait to have you back in the huddle.
Well,
Yes.
thank you, and congratulations again to the both of you, because I'll tell you, it's an amazing thing that you're doing.
Thank
Awesome.
you.
Well,
Thank
thank
you.
you. Thank
Have
you so
a good one, Dr. Levy.
Okay.
Later.
Bye, everybody.
Goodbye. Wow, Jill. When I say I learned so much in this one session with Dr. Levy, it was, this was really, really, really,
much.
really awesome.
Yeah, this was great. I mean, I learned so much. I could have talked to him all day.
I could have too, but when he comes back, Dr. Levy is going to talk about an invention he came up with. I don't want to kind of give it away, but an invention as relates to something dealing with surgery. And it was not a part of surgery for a lot of people that were experiencing it. So I cannot wait to bring him back. He's going to be coming back in December, probably the third week, December 15th, I believe. And he's going to talk more to us about what he got, patent on. And so we're excited about that. So when he come back, we're going to run our mouth again, Jill. You know how we do.
I love it. I love it. I love it. So
Yeah.
we got more to come, but this has been fantastic. Again, parents are always, again, we want to bring the professionals in, and sometimes we don't talk about it. We pray about it. We say, Lord,
Yeah.
it can be free, but it's always best to be educated. And so I think what he was able to do was educate us, inform us, so we know what things to look out for.
Mhm.
ACL tear does not mean that's the end.
Yeah.
He's a physician. I just love his spirit too when he talks. Sometimes physicians don't give credit to the great physician.
Yeah. He stopped there. He was like, hey, wait a minute. Let's stop right there.
Yes.
God, he said, God, he don't know how it's picked, but he said he knows
I love that too.
In there with them. He said he had to be like, how did this happen? But he's just one of God's generals helping out the people, the bodies, right? Helping out the body of Christ, no pun intended.
Yes.
But Jill, we have had an amazing show. What do we have coming up next week?
I don't have that in front. I was looking for, I don't have, but I will. We're going to have somebody fantastic, put it that. But we are doing something special for Thanksgiving.
Okay.
We're doing we have collaborated with moms across the U.S. To celebrate Thanksgiving. We're going to give a shout out to the schools that our kids attend, and to the other families, because again, in the huddle, no parent stands alone, and we're going to show that and collaborating with it. Just a quick thank you video for moms that are appreciative and thankful for the opportunity for their kids to play sports. So I'm looking forward to that.
Amen. That's right. All right. We had some great people on here today. We had Natasha, we had Asia, we had Miss Perry.
Love it. Our peeps.
And we had some people that was joining, and some people we didn't know who they were, but we're getting a lot of people. But if you haven't done so already, go like, comment, and subscribe to our Facebook, our Instagram, our YouTube channel, to where when things drop and we go live, you're able to get our live episodes when they drop. And if you don't watch it when they drop on live, you can always go back to our YouTube channel on Moms in the Huddle.
Yeah, and I just want to say to some people who are joining us who are acting ignorant with the ignorant comments,
I did see it. You will not be posted.
Yeah, you will not be posted, and you don't. I just want to tell you, you're messing with God's girls, and we don't play that, and he don't play that. So go find another channel. We don't play that. So that's all I got to say.
And I love that you did that. That's all a part of being a mom. Don't come up in here acting up. I don't know what it was. It seemed like we had a number of people that were coming on. I did see the traffic. But then we had some people came on that were putting up derogatory things. And we're not going to have it. We will block you.
Oh, we will block you. Anyway.
So
block and report.
Well, we want to say to everybody, if we don't say it already, happy Thanksgiving.
Yes, happy Thanksgiving.
Happy Thanksgiving to everyone, and may you have the most amazing Thanksgiving, and may God be good to you and bless you and keep you, and you may enjoy your time with your family.
Yeah. All right. Moms in a Huddle.
Yeah, amen. Have a good one. Love you, Jill.
Love you too, baby.
All right. Bye bye.